In the last lecture or two, we've been discussing questions about life and death and some of the difficult ethical issues that occur when we make decisions that relate to questions about the sanctity of life or who should live or who should die. Today we're going to have the privilege of talking to somebody who makes those decisions as part of her working life. We're speaking to Dr. April Dvorets at Emory University in Atlanta, Georgia. Dr. Dvorets is a neonatologist. She's had 25 years clinical experience working in intensive care with newborn infants, and she's also a professor at the medical school at Emory University. She came to my attention particularly because in August 2013, she had an article in the New York Times called End of Life at Birth. And the article began by pointing out that it was 50 years from the birth of the last child to a sitting president to a boy called Patrick Bouvier Kennedy, born to Jacqueline Kennedy and President John F. Kennedy, who was born premature, 5.5 weeks premature, and who died despite, of course, getting all of the best medical attention that a child could possibly get in the United States 50 years ago. And Dr. Dvorets pointed out that neonatal care has improved a lot since then, but the very improvement which enables us to save smaller and smaller babies raises some very tricky ethical issues. So, Dr. Dvorets, welcome to Practical Ethics, and I'd like to invite you to tell us about some of the cases that you deal with and that you think have raised some of the more difficult ethical issues and how you've gone about handling those questions.
Well, I can give you an example of a baby named Heavenly Young. Her mother, Miss Young, was an 18-year-old who had really not thought about her values at all. And I was not taking care of the baby at first, and so the neonatologist had spoken with her a bunch about her decision because the baby was severely asphyxiated, meaning that there was not enough blood flow or oxygen going to the brain prior to delivery. And so the baby was on a ventilator. The baby had an EEG which showed flat brain waves, which essentially means that she didn't have very much activity in her brain at all. And so the concern was that her future life was going to be one where she would never be able to know her mother, understand anything, be aware of anything in life at all. And so the doctors were talking to her about withdrawing life support from Heavenly and giving her comfort care, which is basically giving her some pain relief and allowing her to die after coming off the ventilator in her mother's arms in a peaceful way. And instead, her mother refused, said she couldn't kill her baby. That was, and that's an option that parents have, but because this baby's impairment was so severe, and the concern was that she really would not have a good life to live, that a lot of the nurses and doctors were having a lot of distress about the situation. And that was because they felt she would be on a ventilator for the rest of her life. It would be very hard for her, and probably she'd end up in an institution because her mother would not really be able to take care of her. And so we instead decided that, and she just said, no, I can't take my baby off a ventilator. I want my baby to live. One day I was on call on the weekend, and I saw her and I said, I know a lot of doctors have been talking to you about your baby, but have you thought about what you think about life and what your values are? And she hadn't. And so I then talked to her more about her values. And what I found was that her values, because she wasn't unaware of them, she really wasn't sure what she thought about a baby that wouldn't be able to breathe on her own, wouldn't be able to understand, know her, even feel any love or give any love. And so she said she would think about it. And it took a few weeks for her to come back in and at the same time that I was there. And when I did finally see her again, I asked her about it. And she said that she didn't really think that the kind of life that Heavenly would have was a life worth living. And at that point, I decided to ask her about whether she wanted me to decide for her. And she did not. She said her stepmother was against her killing Heavenly. And I explained again that she wasn't killing anyone, that we were just right now doing a lot of technological things to keep her baby alive. And eventually she did say that that was really what she wanted for her child, that she didn't want her child to have such a life as that. And so we went back into her room, and when she saw Heavenly, she just said, no, 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 I can't do this. And it was a few weeks later that the doctors were talking to her again, and she asked to speak with me. And she said, what should I do? And I said to her, you know, this isn't my decision, but from the values you've told me about, it sounds like what you really want is for Heavenly to be at peace. And so she agreed, and we went ahead, and while she was holding Heavenly, I took the ventilator off, and she died peacefully.
Mm-hmm. Right. So in the end, it was the mother's decision to do that, and in a way, I suppose you were giving the mother the opportunity to think about her values and reach her own decision, right?
Yes, and I think a lot of times parents don't realize that their values have something to do with that decision. There's obviously an emotional component for a parent making that decision to not want their baby to go. And there's always, obviously doctors can't see the future. We give our best prognosis, but we can be wrong. And I've heard of a lot of parents telling me that the doctors said X, and now that didn't turn out to be true, that the children did much better. I think that the parents' values really need to be in there because they're going to be taking care of this child down the road.
So it wasn't a matter just of resources. I mean, if the mother had said, keep treating all the time, you would have continued. This baby would still be alive, perhaps, although not really aware of her surroundings. Is that right?
That might be the case. It is possible for doctors to consider a certain kind of treatment futile. And so there are doctors that will say that keeping that baby alive was futile because she didn't have a reasonable life down the road. But that does get into making value statements because there are people that believe that life is sacrosanct, regardless of what kind of a life it is.
Right. Okay. Now, in the case that you've just described of Heavenly Young, the baby was so brain damaged that I assume the baby, Heavenly, was not suffering in any way. She was not really capable of suffering. Is that right? Could you talk to us about a case where perhaps the baby is suffering and how that changes the nature of the decision made?
There's a case of a child with epidermolysis bullosa, or EB, which can be a serious disease. It's genetically inherited, and there's a spectrum of symptoms from mild sloughing of the skin to very severe sloughing of the skin that results in not only sloughing and pain during the episodes, but also scarring and deformities. So that there can be, in the severe form of the disease, a parent might want to make the decision to not keep their child in a, if not constant state of pain, a frequent state of pain.
Okay, so what do you do in that sort of case?
We talk to the parents, and the parents can decide. Now, if the parents decide that they want to keep the child alive, that is their choice, and then we would have to treat the child with pain medication.
That would be pretty tough, I would think, if you think that the child doesn't really have much of a future and you see that the child is suffering. You would still keep that child alive if that was what the parent wanted?
I probably would in that situation. It's hard to say. I'd say I have at times felt this type of moral distress where I feel like what I'm doing is really doing harm to the child, but my values do not really reflect the parents' values necessarily, and so it's the parents' values that are the ones that are considered to be the ones we use for decision making.
Right.
Because it allows autonomy for the child, since the child can't make a decision. In this case, an infant can't make a decision, then the parents are the ones that are considered to have the best interests of the child at heart.
So far we've talked about two cases in which, well, in the first case anyway, at least initially the mother wanted the child to be treated, and it took several weeks for the mother to clarify her values enough to come around to the view that she didn't. And then we talked about a case where you were troubled by the fact that the child was suffering. So what about a reverse case where you think that the child's prospects are reasonable with treatment, but the parents perhaps don't want the child treated? I mean, there was a famous case of this with the Baby Doe case, which was a baby with Down syndrome who also had a blockage of the stomach. And the parents say, no, we don't want the operation performed, and without the operation the child will die. But you think perhaps that the operation can be performed, that it's not so difficult, and that the child can have a worthwhile life. What do you do in that situation?
Well, there are two options. One is to speak with the family. Obviously, I assume in your scenario that has been done already, and there's no way of meeting. I would try to get some expert mediators involved. A lot of times when you have a mediator, they can really work at identifying the issue and trying to come to some kind of a compromise. And if that didn't work, and there was no legal precedent, so a lot of times there are legal precedents. For example, for a 25-week infant, I would not withdraw. That's not considered ethically appropriate. The standard of care says that we don't provide comfort care because the parents want us not to do intervention for somebody of that gestational age. But I could easily see parents that would say, I don't want a baby with the risk of severe problems that a 25-week baby is going to have. And in that case, I would explain that I didn't have a choice, that this is what the law says, and then if they wanted to make a bigger deal, they'd have to go to court about it.
Right.
And there are times that, for example, with a Jehovah's Witness, when they refuse a transfusion, we automatically go to court to get consent to do the transfusion. Now, this is a little bit different because most of the time the parents know that it's going to happen and they accept it because they've done what's right, and therefore the sin is not on them, and there is no downside, as far as I understand, for their child either. Right. So that it's not a big deal.